You're listening to Travel Nursing and Allied Life, hosted by TravCon.
Hello, everyone. Welcome to another episode of the Travel Nursing and Allied Life podcast. I'm your host, Dylan Collier, traveling physical therapist of the Allied Minute, host of the Allied Minute. And today we have Laurie, who's a travel sonographer. But Laurie, could you please introduce yourself to the listeners?
Hi, I'm Laurie Myers. I have been doing cardiac ultrasound for about 25 years. And I've been traveling on and off since 2016.
Very cool. And listeners, this episode is going to be jumping into the differences between travel nursing and travel sonography, specifically cardiac. And so if you are a newer traveler listening to this, this will break down the big differences between travel nursing and your profession. That way you can kind of, when you're reading these blogs or listening to other podcasts, you can really decide what information is pertinent to you when you're listening to something on travel nursing versus something that's a little bit more specific to sonography. Also, if you're a new recruiter, welcome. We also do this for you guys. A lot of times when recruiters are coming from travel nursing side over to the allied side, there's big differences or little differences, and they're needing to learn those as well as they jump in. Laurie, for sonography, when you are in school getting ready to start working, what does the education requirements look like?
Sure. So the education requirements are set by the registry organizations. There are two registry organizations that are used right now in cardiac ultrasound. One is CCI, which is Cardiovascular Credentialing International, and ARDMS, which is the American Registry for Diagnostic Medical Sonography. So those requirements for education can be found on their respective websites. But for the most part, it is, you have to have an allied health background. Most allied health programs are at least a year or two long. And, you know, that can go all the way up to a 4-year degree, but the minimum requirement is usually an allied health degree.
Got it. And then before jumping in to travel, about how much experience do you need before you're able to start your career as a traveling sonographer?
So most recruiters ask that you have 2 years of experience in a hospital setting. Clearly, the more experience that you have in the hospital setting, the better. They like you to be proficient in stress echo and TEE. Sometimes they want PEDS. I'm not a PEDS tech, but I have worked where PEDS is a requirement, but it's limited pediatric experience. And that's usually because they want to send you to the NICU to rule out any serious congenital situations where they might have to life flight a baby out to another hospital. Now, that does vary from facility to facility. So it just depends on what the assignment looks like for that contract.
Got it. And are you able to jump between settings or specialty? I know there's like kind of the general sonography and then there's the cardiac sonography. Are you able to jump between those pretty easily, or would you need to have those 2 years experience before jumping into that setting?
So general ultrasound and cardiac ultrasound are two totally different specialties. So general ultrasound is pretty much, it can include vascular as well, but vascular can also be included with cardiac. That's really the only component that can kind of toggle between the two. So general ultrasound would be your OB, abdominals, pretty much all the other internal organs. And that is usually performed out of radiology. If you're a cardiac sonographer and you travel to a smaller hospital, particularly a critical access hospital, you will most likely be working out of the radiology department as well. But for the most part, you work out of cardiology at the bigger hospitals.
Got it. Awesome. And when you are getting licensed, you're moving between state to state. are there specific state licenses that you have to get in every state? Is it a national license? What does the licensure process look like?
So CCI and RDCS. So RDCS is for cardiac sonography, but ARDMS is that governing body. So if you are an ultrasonographer in general or cardiac, you are going to be licensed nationally. However, there are a handful of states, and you'll want to check with your recruiter, and also you can Google it. It's readily available online. There's a handful of states that also do require state licensure. One of them that sticks out is Oregon. And so if you go to the state's website, the information is readily available there, and your recruiter will help you get that state licensure. However, it's always best if you have that licensure already, because then you're ready to go and accept a contract if offered immediately. The process in some states can be daunting from what I understand. I have not worked in a state that has a state requirement just because I haven't been interested in working in those states at this point. But the process can be fully explained on those state websites.
Yeah, for therapy, it kind of depends on the state. It could be as quick as 2 weeks, could be as long as 3 to 4 months, sometimes longer if they're really backed up. But usually the recruiters have a really good pulse on how long it takes for those specific states. And hopefully they also have like kind of a time expectation on the website as well. Laurie, what does orientation usually look like for you when you're showing up? And are you getting kind of just thrown into the middle of everything after a HIPAA quiz, or do you usually get a week to kind of get your bearings and hit 100% productivity? What's that look like?
So orientation usually involves some kind of modules to be done before you go to the facility. But I have gone to some facilities, although it's not the norm, where modules aren't required. And every travel company sort of has their different requirements based on the facility's needs. So like the assignment that I'm on right now, I had to do modules, and I think there were 20 of them that were required before day one. So my particular company paid a standard rate for that. So you'll just have to check with your recruiter to see how pay works for that. But pretty much facilities want you to be up and running usually that first week where you're independent. You just have to check with your recruiter. It can be a week, but in my experience, they want you up and running right away.
Mm-hmm. Absolutely. Got it. And what does the typical schedule look like? Are you doing a lot of weekends, traveling around? I know for therapy, we don't really work night shifts or anything like that, but anything that a recruiter might not know coming from like the travel nursing side, what does your schedule usually look like?
So I will tell you that it varies widely for cardiac ultrasound, and it's really going to depend on the facility where you're working. So you can work, what I have found is that most of it is days. And some facilities require call, some don't require call. I have seen 24-hour shifts where the hospital is staffed 24 hours, and you might work 4 10s, you could work 5 8s, you could work an evening shift or an overnight shift. So it's really based on kind of what you want to do. You can pick and choose the assignments that you want to take. After 25 years, I prefer not to take call anymore, but I will. It just depends on what that call rotation looks like. If it's every 6 weeks or so, then maybe I would agree to that. It just depends on other factors of that particular contract.
Got it. And for maybe some newer travelers that are well versed in sonography, but kind of newer to the travel scene, is there anything clinically that you can kind of recommend, or might be a little bit different when thinking about kind of working at the hospital permanent that they have been when jumping into travel? Is anything change clinically when you start traveling?
So, some of the things that you need to be prepared for are the different machines that you might work on in ultrasound. Some facilities have older machines that are dinosaurs that some of the newer techs may have never used before that require a little more tweaking than some of the newer machines. After working in this field for so long, I find a lot of the older machines and the new machines are similar in the knobology, but they might be in a different location on the machine. So when you talk to the facility during the interview process, ask them what machine that they're currently using. Then you can get online and look and see what the knobology is and what the settings are that you can change. And I find that to be really helpful. I also like to ask if they can send me their protocol beforehand so I can get used to it and look it over and see what's expected of me when I'm scanning a patient. So most facilities do follow a set protocol and they like you to stick to that. So I find that to be helpful as well.
Got it. Awesome. And for the recruiters that might be listening, what's a typical day look like for you when you're on the floor and kind of seeing patients? Are you bouncing around between rooms? Are you all over the hospital? Are you sticking usually in the cardiac ICU? What's your typical day look like?
Again, it really depends on the facility. So I have worked at some facilities where all I do is outpatients, but in the hospital setting. But most of the time you're not just doing outpatients. If you're at a hospital, they will have us do inpatients, and that could look like, depending on what programs they have. I'll give you an example. When I was in New York, they had a very heavy structural heart program. So we worked in structural heart with the TAVR valves. We also worked in the EP lab. So we were in the cath lab area most of the time with the cath lab scrubs on so that we could pop in and out of those rooms. And now with COVID, we are going into COVID rooms. We're doing scans on LVAD patients. So if you're at a level 1 trauma facility, you could be doing any one of those things during a typical work week. I find that to be extremely fascinating because instead of being a robot doing one thing the whole 13 weeks, I like to jump around from structural heart to EP to doing the LVAD patients to the NICU. I just think that that's really exciting, and it keeps my interest for the time that I'm on those contracts. So you could expect pretty much anything when you're at a level 1 trauma facility. And then if you're at a critical access hospital, you might have low volume where you're only doing a couple of outpatients and a couple inpatients a day. And it could wind up being a snooze fest if you're somebody who's used to being busy in that 8 or 10 hour shift.
Got it. Well, Laurie, that was all my questions. Thank you so much for coming on and sharing your information. If you are listening to this, again, welcome to the Allied Minute. We'll have more series on this comparing allied professions to travel nursing. But thank you so much, Laurie. I really appreciate it.
Thank you, Dylan, for the opportunity.
Thanks for listening to Travel Nursing and Allied Life. You can find the full show notes below or at travcon.org. Please help us out by rating our podcast on iTunes or wherever you get your podcasts.